Hi guys, today I'm going to talk to you about this article that I was reading. It's a good article because it's a question that I'm asked very often by a lot of my patients. And it talks about kind of those when you have your head injury, what are the chances or the risks kind of going forward with either behavioral or some other comorbidities that can really impact your health going into the future. So this one was done by Izzy and about 13 of other colleagues. Again, I'll link the post or the article below if you'd like to kind of read through it yourself. But what this one did, and it's kind of an interesting article because they follow up a fair amount of head injury patients. Most of them sustained from falling, and then the second most occurrence was from motor vehicle accidents. But what they found was there was indeed a link generally found for increased comorbidities, usually after a 5-year time frame. So then in this article, they actually followed the patients for 10 years, and they found that kind of consistently that was the kind of the threshold that they would see most common. And some of the things that you can note or you could see in terms of changes is you were kind of at higher risk of psychological problems, maybe depression, anxiety, some sleep issues, a little bit more alcoholism. You also have some potential concerns with regards to hypertension, hyperlipidemia, some diabetes that was also kind of brought up. So they did see some links in there. Now, one of the things that I would like to see kind of studied or looked a little bit more into details is in terms of these patients, how many of them were they followed up with rehabilitation, where they actually kind of pushed those people to kind of improve upon some of their symptomatology. So, with regards to it, we already know that with head injuries, there is a large amount of autonomic function dysregulation. So, if that's kind of going on for an extended period of time, well, how much damage or how much do we look into that in terms of does that have some of the cause, or is that one of the resulting factors for what might be making these comorbidities happen with these individuals? It's just an interesting point. Of course, I'd like to always think in terms of when you're dealing with anybody who has any head trauma, the better you rehab them, of course, the more likely, or I guess the less likely they are to have kind of injuries or problems down the road. Whereas two patients, if you look at one that has been rehabbed, one that hasn't been rehabbed, the individual who hasn't, there's a higher likelihood that they're going to have more issues kind of going down the road than the person who's been able to push to kind of improve upon some of those centralized systems going on in their head.